So once you have Original Medicare Parts A and B, you need a plan to fill the gaps. So last lesson we went over supplement plans, which is option number 1, and option number 2 is Advantage plans, which is what we're diving into in this lesson. So Advantage plans are about 10 years newer than supplement plans, and they're designed to replace Original Medicare completely with an all-in-one product that bundles in your drug coverage, bundles in extra benefits, and can be structured more creatively than the supplements, which are standardized. Like I illustrated before, if you go the supplement route, you would maintain Original Medicare through the government, and then you'd add on a supplement plan, also known as a Medigap plan. You would also have to add on a prescription drug plan, and then extra dental, vision, hearing plans as you see fit. With an Advantage plan, you're replacing all of that with one single plan by a private insurance company. Now with Advantage plans, there are a ton of misconceptions. I think part of this is just because they're a little bit newer than supplements, and another part is because they can be structured very creatively by these private insurance companies. There's often one really big selling point with these Advantage plans. They often have a $0 premium, a $0 deductible you have to hit, and they bundle in drugs, dental, vision, hearing. Sometimes they even bundle in a Fitbit, a gym membership, and even a little credit card for over-the-counter items. So overall, I'm going to illustrate the difference in cost structure between supplements and most Advantage plans. Now remember, since these plans can be much more creatively structured, this $0 premium, $0 deductible is not always the case. Some of them have premiums and have deductibles, and they tweak benefits in other ways. So to illustrate the main difference in cost structure, on the left side, you'll see that if you keep Original Medicare plus a supplement plan, you will have a guaranteed amount that you're gonna pay each year, and usually that'll be paid monthly or quarterly. Now on the right side, if you choose an Advantage plan, you start much closer to zero, if not at zero, and then you pay for services and drugs as needed. So that orange bar you can see is racking up as you pay for the things you need. There's another really important feature with Advantage plans called the maximum out-of-pocket, or the MOOP. Sometimes I like to call this the copayment ceiling, because at this point, if you reach this number in copayments, you will stop paying completely. It is the maximum that you will pay out of your pocket. An important note is that very few people actually reach the MOOP. About maybe 2 to 9% of people on Advantage plans actually make it to the MOOP. So you might be wondering, how can Advantage plans afford to offer a $0 premium, $0 deductible, and even bundle in extra benefits like drugs, dental, vision, hearing, and so on? There are two main reasons why insurance companies can afford to do this. Number one is that Medicare, the program through the Social Security Administration, actually pays the private insurance company to facilitate these plans. So over your working life, you paid money into the Medicare system through your taxes. Now imagine that the Social Security Administration set aside some amount, let's call it $1,000 a month for easy numbers, to actually pay for your healthcare claims. So when you decide to use an Advantage plan, which replaces Original Medicare, Medicare will take that $1,000 and actually throw it over to the insurance company. So a lot of the time, people will see that $0 premium, say, how is this plan free? And I like to tell them it's not free, you're just not paying for it right now. The government is paying for it right now because you paid the government all those years through your taxes. And the second reason why Advantage plans work is because they reduce fraud, waste, and abuse. Fraud, waste, and abuse in medical insurance is basically when people are overusing their insurance and getting procedures that they might not need. Doctors sometimes will fraudulently bill Medicare for services that they didn't even do. Through Advantage plans, private insurance companies will use copayments, prior authorization, and networks strategically to make sure that they're not paying a ton of claims that are fraudulent or wasteful. Copayments with the pay-as-you-go model will make people a little more cognizant of the services that they're getting. With prior authorization, sometimes companies will require that you get a referral or you get a procedure authorized before you go and have it complete. And finally, all Advantage plans use a network in some way. There is a ton of talk about networks with Advantage plans. HMO, PPO, POS, ACDC, ZZ. Some of these are overused just for marketing purposes, but there are a few important distinctions I want to make between HMO and PPO. HMO is short for Health Maintenance Organization. If an Advantage plan is an HMO, it means that you must stay in the network. If you go out of network, you'll most likely pay the full price of the service. Depending on the company, they will allow you to go out of network if you get the proper referral. And a PPO stands for a Preferred Provider Organization. If an Advantage plan is a PPO, it means that you can go in network or out of network, but you're gonna get a better price if you stay in network. And if you go out of network, you're not going to pay the full price, but it will be a little bit more. A quick note about HMO is that there's actually a hybrid between HMO and PPO called an HMO-POS. You can go out of network, but only if you get a referral, and you'll most likely pay a higher price, kind of like a PPO. There are two more really important notes I want to make here. Sometimes people really freak out about HMO, thinking that they won't get the care they need. But in reality, many of these large companies have extremely robust networks. For a lot of the companies I broker with, it's actually pretty tough to find providers outside of the network, making HMOs a lot better than people think. And second is that some of the PPOs are actually offering the same price for in-network services and out-of-network services, which basically means that you can go anywhere for about the same price, in-network or out-of-network. Now, I have seen people stress way too hard about choosing HMO versus a PPO. So here are a few quick tips to help ease those concerns. Number one, if you travel a ton, you're probably gonna wanna go PPO. And if you don't travel a ton and you go HMO, you may be wondering, shoot, what if I actually do wanna travel? Then what happens? Under Medicare, no matter what plan you choose, urgent and emergency are always covered at the hospital. So rest assured, if you choose an HMO and you do go out of network, but it's urgent or an emergency, it will be covered. You will not have to pay the full price of the service. And one final very important rule to help ease your nerves around Advantage plans is that all Advantage plans have a 12-month trial period. This means that if you switch from original Medicare with a supplement to an Advantage plan, then you have 12 months to switch right back with no questions asked. After this 12-month period, you'll be subject to underwriting, which could raise your premium for the supplement plan or even prevent you from getting it back. However, now we're starting to even see Advantage plans that mirror supplement plans. If you pass that 12-month period and you're afraid of being subject to underwriting, then you could check out one of those Advantage plans that act kind of like a Medigap plan with a premium, and you will not be subject to underwriting. One final note on Advantage plans is that since insurance companies can get creative with the structure, they have actually made special Advantage plans for people in unique scenarios. So for example, if you've ever worked for the government, if you're a veteran, if you have a chronic disease, or if you're on Medicaid, there might be Advantage plans tailored specifically to you. So in summary, Advantage plans are the privatized replacement of original Medicare. They're an all-in-one plan that bundles in drug coverage, dental, vision, hearing, and other benefits. They all have a maximum out of pocket, and it's more of a pay-as-you-go structure than a supplement. So now you're wondering, how can I actually start to see these Advantage plans? So when it comes to browsing the Advantage plans in your area, I have decided to become trained and contracted with some of the best insurance providers in the nation. Providers like United Healthcare, Humana, Aetna, Health Alliance, Blue Cross Blue Shield. So if you want to see some of my top picks available in your area, check out resource number 8. This is going to show you all the Advantage plans that I'm licensed to sell in your zip code. You can even add your medical preferences, like your drugs, your doctors, your pharmacies, and it'll spit out a cost estimation for your Advantage plan. So now that you understand Medicare and that we need to choose one of the two options between supplement or Advantage plan, in the next lesson, I'm gonna dive deep into real life examples showing you the difference between supplement and Advantage plan. If at any point during this course you feel like you need help with your Medicare, I'm a licensed Medicare insurance broker, and I'm trained and contracted with some of the top providers in the nation. Providers like United Healthcare, Health Alliance, Humana, Aetna, Blue Cross Blue Shield, and Wellmark. If you decide to work with me, there is never a fee for my service, ever. I'll explain why later. I am only paid if I keep my clients, meaning that my client's satisfaction is my priority. And I offer face-to-face, year-round service. So whenever you're ready, click the button below to continue to the next lesson, where I'll explain supplements versus Advantage with clear examples of costs and benefits.